COVID-19 has provided a sobering reality check, threatening the lives of those we care about and undermining our health systems, economies, and social well-being. Since the early days of the pandemic, WHO and partners have been deeply concerned about its impact on essential services for many diseases, including malaria. Countries around the world have reported disruptions in access to life-saving healthcare and in the delivery of key malaria commodities.
When COVID soared up, we were threatened with the possibility of all services stopping. All servicing stopping because all attention of the health system, of the leaders of government switched to COVID.
At the beginning of the COVID-19, we observed that people were not visiting the health facilities because they were afraid of going to the health facilities and getting in contact with others who might be infected with the COVID virus.
In Nigeria, the country that carries the highest burden of malaria, the depleted health workforce, diversion of resources, and interruption of supplies compromised the delivery of essential services. In India, lockdowns and travel restrictions threatened to reverse the impressive gains seen in reducing malaria over the last decade. Other countries aiming to eliminate malaria, such as Suriname, also experienced major setbacks.
COVID led to travel restrictions and intermittent, partial and full lockdowns of the country. So we had very little freedom of movement at some time. And also the COVID led to international markets for antimalarials and lab supplies becoming under pressure.
In many settings, the lack of personal protective equipment compromised the safe delivery of health services.
I think it's important to say that the lack of access to personal protective equipment has been an issue. And as I mentioned, this underscores the need for a commitment to equitable access to essential commodities under a framework of true global solidarity.
Despite the myriad challenges, many countries have succeeded in sustaining essential services to protect people from malaria and diagnose and treat those infected.
There was a remarkable coming together and energy around how to adapt and do bednet campaigns differently, how to get through some of the disruptions to the supply chain. So I think collectively as a community, that was a really commendable achievement. And I think a lot of people on the ground in the countries did some great stuff to make that happen.
The pioneering work of Benin to safely deliver insecticide-treated nets was followed by many other countries with a high burden of malaria. South Sudan delivered nets in the face of COVID and other emergencies, such as severe flooding. Uganda protected and motivated health workers and secured the necessary commodities to fight both malaria and COVID-19. Cameroon safely and effectively delivered preventative antimalarial medicines to children at highest risk of malaria. Through these and other efforts, many lives have been saved. But the battle is far from over. COVID has upended health systems in countries around the world, and many critical services remain disrupted. These disruptions have compounded the challenges that many countries were already facing in their malaria responses before COVID-19 struck.
As the World Malaria Report had shown over the last 4 years, we had stalled in our progress. And while we have had a fantastic decade of progress, reductions in morbidity and mortality, the last 3 or 4 years were showing the challenge that we are facing.
Addressing the double challenge of malaria and COVID will require leadership and political commitments that are translated into budget lines and resources. It will require stronger health systems with integrated services, local intelligence, and reliable local data.
We are learning and acting differently. For instance, Mozambique has strengthened integrated delivery of services at community level. We believe this approach will yield value for money, firstly, by investing both in disease control programs and in strengthening health services delivery, and secondly, by rallying other sectors and communities to support disease control.
Country ownership is essential. This isn't just about ownership of data, but full ownership of the data in terms of using it on a day-to-day basis to respond to the challenges and to be problem solvers.
It will require global solidarity and trust, with all levels of society working together.
Interventions such as social distancing and wearing masks or sleeping under insecticide-treated mosquito nets and taking prophylaxis require the entire population to work and respond together. What all of the successful examples we've heard have in common is an approach that builds on these values of trust, solidarity, and the whole of society response, with the countries at the center.
Whether tackling malaria or COVID-19, success can only be achieved through smart investments in health, protecting the economy, and leaving no one behind.
Countries need not choose between protecting their populations from COVID-19 or malaria. They can and should do both.
Investing in health is investing in prosperity, especially if you get the right investments implemented properly. So let's keep remembering about economic impact and keep reminding everybody that that's why we're making such a fuss about malaria, about COVID, and about other health threats.
Above all, the urgency of the COVID-19 pandemic has compelled us to rethink our approach to malaria responses worldwide, with a greater emphasis on listening and learning from countries.
I think it's very important that the voices and the knowledge that exist at the front line and in countries where this disease is a major health problem, those are going to be critical voices going forward.
As the WHO Director General has said, we must listen to their voices, learn from their experiences, and heed their call.